In the last 3 months of 2017 into 2018, the country was hit by a historic cholera outbreak which claimed over 80 lives and affected thousands more. The outbreak was, however, contained following multi-sectorial interventions. On this week's edition of News in Depth, Macpherson Mukoka looks at some of the measures that government and its stakeholders have put in place to prevent the outbreak of this life-threatening disease. I'm your host, Masauso Mukwayaya. Stay tuned.
In the month of September 2017, Zambia was hit by a historic devastating cholera outbreak whose consequences spread to primary, social and economic sectors in the country. The outbreak came into sharp focus on October 6, 2017, following a declaration by the Ministry of Health in Zambia's capital, Lusaka. The declaration was preceded by confirmation of Vibrio cholerae, a bacterium that causes cholera in laboratory tests on stool specimens collected from 2 patients who were initially being treated for acute watery diarrhoea. This was 2 days before the declaration. Since then, cholera cases increased rapidly from several hundred cases in early December 2017 to approximately 2,000 by early January 2018. The epidemic led to more than 81 deaths countrywide, and thousands were hospitalized and treated for the disease. In the last week of December 2017, several interventions aimed at preventing the further spread of cholera were put in place. Chlorine levels in the city's water distribution system were doubled, and emergency tanks containing chlorinated water were placed in affected neighborhoods.
The response was well managed in the sense that we had very good, strong government commitment, and a lot of resources were put in place to ensure there is proper coordination with the various partners to ensure that all the needed mitigation measures were put in place.
The military was deployed in Lusaka to enforce some of the measures put in place to curb cholera transmission. Men and women in uniform were tasked to, among other things, check on compliance on the ban of street vending, public gatherings, and closure of marketplaces.
Now the situation was very bad that we forced, some of the markets to close. People didn't like it. We displaced people in the streets of Lusaka because they had no toilet facilities or sanitary facilities, and yet there were thousands of them selling in the streets, and they were selling ready-to-eat food, and people didn't have facilities to use to wash their hands. They just grabbed whatever they bought and ate, and that was actually helping the spread of the disease.
The closure of trading places like B8 Soweto Market somewhat spelled doom for vegetable traders whose livelihood wholly depended on the very place.
Actually, the place previously was very bad actually. Since, I came here in 1984. This is down now about 34 years. Actually, last time when actually there were cholera here, actually we were very much affected in the sense that the business itself, it was not good.
We had the challenge, we even lost a lot of goods when we transferred to the other market.
In addition to this, schools, universities and colleges were also closed, and curfews were imposed in cholera epicenters.
We were very much affected as a ministry. The last time when we had the closure due to the cholera outbreak. And I must mention that it was a very sad development for us. And then we really learned a lesson from that, and we wouldn't like such a thing to happen again. So we really learned a lot because schools, as you rightly put it, were closed for some time, and it really affected the academic calendar. So it was really unfortunate, and on our part, we really regret it.
The cholera epidemic is not new to Zambia, as outbreaks have been recurring since 1990, with an estimated number of 4,731 reported deaths since then. Last year's outbreak, which spilled over into 2018, is still under surveillance even after it was contained.
We're also ensuring that we are monitoring, doing surveillance, making sure we know what is happening, looking at the trends of the diarrheal diseases, how they are coming, so that we should be able to monitor. If there is any chance of anything that is suspicious, we have a team that moves in quickly and contains, whatever diarrheal disease is quickly investigated and control measures are put in place.
The outbreak is associated with poor water and sanitation infrastructure and indiscriminate waste disposal that help spread the bacterium.
It's for us, the people, to make sure that we don't throw garbage anyhow to block the drainage. We dispose of plastic in the safest way possible, and again it comes back to keeping the surrounding clean. We should avoid having people swim in the drainage. I know in some areas it's quite wide. Children are swimming in there when it's full of water. It's very dangerous because there's a lot of waste going in there, and anybody getting into contact with that water is prone to acquire some waterborne disease.
Majority of households in Zambia have access to improved water supply, but only a few have improved sanitation. This disparity is due to the high cost of sanitation infrastructure compared to water.
We have just handed over Jack compound. We have handed over Ngombe, Chipata compound, SOS East, Kwamwena, Ndeke, Vona Valley. That's a major intervention because then people will not be resorting to shallow wells in those areas. People will be getting water from reliable water sources. It's critical to understand that it is the reliability of water supply to households that is critical to preventing our brothers and sisters getting alternative water sources, water from alternative sources like shallow boreholes, which were responsible for the spread of the cholera epidemic.
In Lusaka, sanitation systems have been compromised by ineffective management of sewer systems. Clogged drainages or the lack of water draining infrastructure also contribute to flooding and contamination of water sources.
The backbone drainage system in the Central Business District is the one that channels most of the water that accrues from Zipas area, Mrs. area, through the Central Business District, in Garden, parts of, you're looking at parts of the town, Emersdale area, through Maziopa into the Ngwerere stream. That's the backbone drain. Once that is interconnected to all the tributary drains, what should happen is that there will be proper stormwater management in the city. Hence, there will be reduced flooding in most of the areas within the Central Business District, which has been a major culprit in terms of acting as a vector or a transmission point for cholera, the problem of cholera.
To counter the cholera situation that broke out a year ago, stakeholders involved have been working on several interventions.
This year we have started messages of awareness to the people. I think some people may receive messages on these phones as SMS, reminding them to wash their hands after using the toilet or whenever they are handling food. Our intervention is to have regular meetings with the Ministry of Health and local government and to encourage people to dispose of their rubbish such that Ministry of Local Government through the City Council can collect the garbage.
In the Ministry of General Education, which happened to be one of the affected sectors, pupil and teacher engagement on the need to have a clean environment is being prioritized.
We make sure that we've enhanced activities. This is what is helping us make sure that we clean appropriately and make sure that every learner is involved in trying to keep the environment clean. And then also I should mention that during lessons, we've made it a point. We've informed teachers through the districts, through the provinces, and also the head teachers that every time they're teaching, before every lesson, they conduct some kind of talks on hygiene, on safety, on cleanliness, just to make sure that the children, the learners, are aware of these issues. So talks have continued, just like we did before. Even now we've continued. Even during assemblies, we have talks.
With the onset of the rains, the Lusaka City Council Public Health Department is reminding Lusaka residents on the importance of keeping their surroundings clean.
We've got our team, the health inspectors and the health promoters, who are going in markets and communities. At times we even go with megaphones to just announce to the people on the do's and don'ts of hygiene, so that people can go buy foods from reputable markets, and also the issue of washing the foods before they eat, and as they washing the foods thoroughly. So that is on the aspect of food. And we are also involved in collecting samples. We are collecting samples which are taken to the laboratories. Currently we are working with the Food and Drugs Lab and also ZABS, which is helping us to deal with of course, analysis of these different samples.
Unsanitary conditions in several markets across the city have been said to be a breeding ground for the waterborne disease. It is for this reason that government has embarked on the reconstruction and rehabilitation of selected trading places. This is BH Market in Soweto, which a few years ago was muddy and sometimes impassable during the rainy season. The market has been rehabilitated and is now conducive for trading.
What we've done since then is to embark on reconstruction, rehabilitation of these markets, and making sure that we form health committees in these markets, committees which are now looking into health issues, how clean the markets are, how clean the toilets are. In cases where we don't have sufficient toilets, we've worked together with civil society organizations or private sector organizations that are providing toilet facilities for fee paying, such as Live Clean and many others. We've worked with them to make sure that they provide these services where the services are not available.
The improvements at BH Market have been appreciated by traders.
Cleanness is next to godliness, and that place they need to be kept clean, and bins they need to be there. The council they need to put the bins there, and those big bins that they are able to put those garbages. So what I can say is they need to follow the regulations and the rules of the council, and to make sure that the environment where they are operating is clean. As you can see where we are coming from, that environment was not really conducive for people to trade.
The traders, who are the ultimate beneficiaries of this market, have spread their wings wide by ensuring that everyone takes part in the cleaning of the market.
Now, actually, we are going to put much effort in order for us to clean this place, so that actually we are not going to experience another outbreak of cholera. As you can see now, the traders actually they are very much happy to trade on this concrete.
Each time we are done with ourselves, we have to clean where we are doing our business. Even if the council people could even come, we take the rubbish, we put them in the bins, and make sure that the surroundings are clean.
As traders, we need to make sure that we need to make sure our members to clean this place, to make it clean as it is now.
The city of Lusaka has a high population growth, particularly in peri-urban areas that lack water and sanitation facilities. Urbanization has led the city to struggle to meet everyday social services, and the need to upgrade infrastructure such as water and sanitation facilities is vital.
This structural intervention in water supply, sanitation and drainage should lead to reduced disease burden within the city of Lusaka. Additionally, we have attracted investment under the Lusaka Sanitation Project of over 375 million US. That is basically building toilets within the city of Lusaka, meaning we are transitioning our brothers and sisters, our mothers and our fathers from the use of pit latrines to the use of waterborne toilets. That is a major mitigation measure, again, in preventing waterborne and water-related diseases. That is being implemented in a number of peri-urban areas within the city of Lusaka, including the construction of a new treatment plant in Ingwerere.
Millennium Challenge Account Zambia is privy to the challenges likely to come as a result of this development.
Our people continue to indiscriminately dispose of plastics, dispose of blankets, dispose of plastics, dispose of bottles, and everything that imaginable is being thrown in the drainage system or just anywhere in the city of Lusaka. And when it rains, all that solid waste is carried by the stormwater and channeled into the drain, ending up clogging that system. What happens is that, the system is clogged. And once the system is clogged, we have a challenge. And the major challenge that we have with the clogged system is that there is improper stormwater management. Therefore, flooding continues. Therefore, we defeat the very purpose as to why we have constructed this drainage system.
Solid waste management is a perpetual challenge in the fight against cholera in Zambia, as the local authorities keep on looking for suitable methods.
We are, of course, collecting solid waste and putting in measures to ensure that solid waste is managed effectively. Because when solid waste is managed effectively, then we will not have flies flying around. And if at all we don't have flies flying around, then the flies will not contaminate the food. So that is a pathway which we are trying to also block. And we, as a council, we are collecting solid waste from different places and also putting in measures to ensure that people are subscribing to the franchise contractors and also the CBEs. And we've also gone further to ensure that the markets are also able to manage their own waste.
The organized traders want the marketeers in recently rehabilitated and constructed markets to maintain the current hygiene standards.
We don't want again the outbreak of cholera like what happened last year. This year we need to put things in order. As you have seen, even His Excellency, the President, they have relaunched the Keep Zambia Green and Healthy. So we need to follow that and to make sure that each and every person who throws garbage anyhow need to be apprehended and to make sure that the environment is kept clean.
Although the 2017-2018 cholera crisis was eventually put under control, a lot still remains to be done, especially whether the outbreak will prompt policymakers to implement measures that will prevent future outbreaks, particularly where solid waste management is concerned.
Once we pass the solid waste management bill, which is due, to be presented to Parliament in the next few weeks, once it's cleared by Cabinet, we'll now be able to make sure that every Zambian participates, because there are some proposals that we've made there where Keep Zambia Clean can actually be sustained at a world level, where WDCs can champion this at a world level, and they'll be able to make sure they mobilize people from within their wards to take part in this. And also in that bill we propose make sure that everyone takes care of a certain, of certain parameters within their the land they own.
Putting interventions in place is one thing, and making people aware of the said efforts is another task. Therefore, the emphasis on sensitization.
From the inception of this project, we've been engaging with community members, community leadership, councillors, members of parliament, ward development committees, and the general public, to educate our brothers and sisters on the importance of taking care of this infrastructure. The importance of ensuring that we dispose of waste in a proper manner so that it does not lead to clogging of the system and continued flooding, because then the cholera epidemic won't be contained. The only way we can contain that cholera epidemic with the infrastructure that we have is to accompany this infrastructure with responsible behavior.
Collaborative efforts in the fight against cholera, based on experiences in dealing with previous outbreaks, are key in curbing the waterborne disease. The Disaster Management and Mitigation Unit wants this to continue.
DMMU is part of a bigger group that looks at issues of health matters, which is spearheaded by the Ministry of Health and local government, as well as water and sanitation. In the last cholera epidemic, we worked very well together, and we tried to encourage members of the community to donate dust bins, protective clothing, and other materials that are required to help us minimize the occurrence of cholera.
DMMU has an appeal to make, and so is the Lusaka City Council.
My appeal is to request every Zambian to own this Keep Zambia Clean, so that they prevent themselves from getting affected from waterborne diseases, especially that we are going into the rainy season.
Cholera is a hygiene disease, and there are simple rules which are supposed to be taken for us to avoid it or to prevent it. Very simple. Unfortunately, when the disease is not there, we all tend to relax, especially the people who are involved in terms of us as human beings. We continue eating fruits without washing them. We continue shaking hands unnecessarily. Even at churches, we've said time and again, at church, it's not necessary to greet everyone by hand. You don't know what contamination the other person has.
The Ministry of General Education and Millennium Challenge account are happy with the support from the general public.
We're raising future leaders, so we really are happy with what is going on, because we're trying to inculcate that spirit of being healthy, making sure that they're in an environment which is clean, so that even as they grow up, they'll continue living like that. So we just want also to thank the learners themselves, because they've been very good. The teachers, very supportive. So we're very glad that this is happening, and we just hope and pray that this spirit continues, so that we do not have a recurrence of what happened in the past.
One of the workers from ZNBC, McPherson, was able to call us, to alert us to vandalism in Mtendere. 3 women managed to arrest 2 men who were stealing pipes in Mtendere. In Maziopa, 3 community members arrested a gang of about 5 gentlemen who were stealing the palisade fencing. In Misisi compound, it's the members of the community that reported to the police that led to the arrest of 6 young men who were stealing the palisade fencing. So what we are saying is that this proactive response from community members in itself is signal enough that people are taking it upon themselves to protect public infrastructure.
The Ministry of Health is confident that the current multi-sectoral interventions will yield positive results in the fight against the epidemic.
So we are very confident that we have done a lot and we've done enough, and with the proper commitment, as we are seeing from government, from the highest level to the lowest level, we should be able to manage appropriately in case we are faced with any outbreak.
The cholera outbreak in Lusaka offered a clear insight into the deep institutional roots of the problem. There is need to increase public investment in the water and sanitation infrastructure, as is the case with the Millennium Challenge Account project. Institutional infrastructure, matched with competent human resource, need to be enhanced too. This will improve overall delivery and eventual access to such services and prevent future disease outbreaks. Modernization of other public facilities, such as markets, is still an important factor. Observers feel behavioral change and individual conviction to keeping the surrounding clean at all times is more cardinal, as prevention is better than cure.
This is where we come to the end of this week's edition of News in Depth, where McPherson Mukoka has been looking at some of the measures that government and its stakeholders are putting in place to try and prevent the outbreak of cholera, especially in view of the onset of the rains. I have been your host, Masauso Mukwayaya. Thank you so much for watching. Join us next week for yet another interesting edition of News in Depth documentary. Please enjoy.